This is my audience. Hi, my name is Ashley Peterson, and today I'm going to tell you a little bit about Parkinson's disease. About 50,000 Americans are diagnosed with Parkinson's disease each year, but that doesn't reflect the cases that go unknown. As you can see over here in my chart, 50% of men are more likely to develop this disease than women. People with Parkinson's disease usually require more assistance communicating and with their daily living activities depending on how progressed their disease or how far along they are in the disease. Parkinson's disease is a disease that affects the nervous system. As shown in this picture of a brain I have, the motor cortex, which is the frontal lobe of the brain, is a grayish blue color. That is the part that is affected by the disease, and the nerve cells are in the deep part of the brain are the ones affected, which is what also produces dopamine. But like I said, as you can see, it's a bluish gray color. That is the part of the brain that is affected by the disease. This disease affects many people in different ways. Some people as in movement, some people their muscles stiffen, and some people speech and communication is a big part for them. We do have many different methods to choose from when communicating with people that have this disease. Working in a healthcare facility, I had a chance to learn what Parkinson's disease was and how it affected some of my residents. Taking care of a number of residents that, one resident would be at a stage 1 Parkinson's disease and the other would be at stage 5. So the one at stage 1, they might not be, they would be able to communicate effectively and walk and talk, where the person at stage 5 may not be able to speak or communicate with anybody. Doing continuing education for work let me do some specific research on this disease, and it gave me some tips on how to communicate effectively with my patients, since I had such a wide range and wide variety of patients that were at different levels in the disease. So the question is, what is Parkinson's disease and why should we be educated on it? Parkinson's disease is a progressive disease of our nervous system. Like I showed you up here, it is in the frontal lobe of our brain that is affected by the disease. According to the National Parkinson's Disease Foundation, they would describe Parkinson's disease as a person's brain slowly stops producing something called dopamine, which, like I described up here again, dopamine is produced in the frontal lobe of the brain. As Melissa Stopler states, age is the largest risk for developing this disease. Usually it is over the age of 60. In this chart over here, it does say 1 in 10 Americans are diagnosed with Parkinson's disease before the age of 50. Many different changes become present in this progressing disease, making speech less precise for some and more challenging to understand. As Angela South states, this is caused because the brain changes, it makes it difficult for a person to follow internal cues, telling us how much effort is needed to produce a clear voice. People are living longer, therefore they believe this disease will only climb higher on the charts, meaning since we're seeing the elderly living longer, more people are getting diagnosed with it, so therefore we'll probably see the percentage of this disease go up. What are some effects on people who are diagnosed? This disease affects people in many different ways, like I said, one of them being communication. Patients with this disease have many obstacles to overcome, but there are treatments out there. All patients range in different stages of the disease. Like I said, you could have someone who is at the very beginning of Parkinson's disease, so they are at stage 1, and then you could have someone who's at stage 5 who is no longer able to communicate or speak with other people. Now that we know now that we know what Parkinson's disease is and how it affects people's everyday lives and communications, we can discover the different treatments to help them go on to be able to communicate effectively and live their daily lives with others. Medications being the first example I have. Medications is usually what they will put a patient on as the first thing, I guess, to see if that works. If not, there's obviously other treatments. But one of the main medications that is used is called levodopa, which is also called L-dopa. Levodopa is transported to the nerve cells in the brain to produce dopamine, which, like I showed you up in here again, that is where dopamine is produced, and that is also the part of the brain that is affected by the disease. So since it's affected, dopamine is not being produced. Down here I have a picture of vocal therapy, and vocal therapy is another option for people to be able to communicate more effectively. They go there and they work, the physical therapist works with them to be able to speak louder and speak more clearer and be able to eventually communicate effectively. And the last option would be surgery. Brain surgery may be considered when all else fails. But then again, brain surgery is not a complete cure for this disease. Brain surgery can be done, and you will still have to take medication. Not as much medication as you did before, but you will have to take it, and you still might have some side effects, but like I said, you're definitely gonna, it's not gonna cure 100%, but you will not see as much, you won't have to take as much medication or, see as much side effects as you used to. The main brain surgery that they do is called the deep brain stimulation. It uses electrical impulses to stimulate a target area in the brain. It is the preferred surgery for treating most cases of advanced Parkinson's disease. Now, people who have other serious problems like psychological problems, or maybe they have kidney failure, cancer, lung disease, they're usually not candidates to have the surgery done, but speaking to your doctor is also an option. And lastly, over here I have a healthy patient and a Parkinson's disease patient. The top is transmitting neurons, the middle is dopamine, and the bottom is receptor cell. As you can see in the healthy patient, the dopamine, there's a lot more dopamine being transferred down to the receptor cell, as in the Parkinson's disease patient, you see far and few between of dopamine being transferred down to the receptor cell. I hope you enjoyed learning about this progressing disease and how it affects people's lives in many different ways. I hope you can take some of the skills I presented to you to improve your communication skills with a family, friend, or loved one with this disease. The main points I touched on are, I defined what Parkinson's disease was. I told you how it affected people's communication skills in their everyday lives. And I gave you some treatment options of medication, vocal therapy, or surgery choices. And lastly, I'd like to share a quote that I believe fits everyone, especially someone dealing with the disease. Michael J. Fox states, "My happiness grows in direct proportion to my acceptance, and inverse to my expectations. Acceptance is the key to everything." If I could give advice to anyone, acceptance is everything, whether it be in yourself or it be in someone else. Thank you.